Hi everybody, this is a part one of the soap note presentation, and in this is a soap note of week 2 on asthma. ID is MF, 27-year-old white female, arrives to the clinic complaining of accompanied by the husband. She is a reliable historian. Her chief complaint CC is chest pain, shortness of breath and wheezing for 7 days. HPI, a 27-year-old female coming to the clinic with chest pain, shortness of breath, wheezing, and coughing, times 7 days. The patient stated that she tried to control the symptoms with the Tylenol, acetaminophen. She reports the sleeping has been difficult for a few days because the symptoms are worse at night and during the cold weathers. Patients also complained that she was having a feeling of syncope and dizziness during this morning before she came to the clinic, and she was been feeling dizzy and weak, and she feel like she lost some weight for last week, and it's been going on for a few days, like 4 to 5 days. And patient is thinking that did she denies any travel history or any recent travel, but she said she might have contracted it from the work because her co-worker was having the same symptoms a week ago, and she also complaining of chest pain, 7 out of 10, and the chest pain is worse when she is coughing, so she's having a pleurotic pain with cough. She have a previous medical history of asthma during the childhood and until high school. She also had a chickenpox at the age of 18, and she also had a malaria at the age of 15. Then if we talk about her surgical history, she have a history of C-section in 2018. Her allergies are no known drug allergies, but she has allergies to pollen grains and cat allergies. No allergies to any latex products. Vaccine wise, she received all the childhood vaccinations, but she receives the flu vaccine every year, and the last flu vaccine was in October of 2023. Then her social history is she was smoking marijuana until high school, during the high school years, and she drinks socially maybe once a week. And she also have a family history, pretty significant family history, not pretty significant, but she have a family history that her sister was diagnosed with asthma as well, because in 2012, but she is an orphan, she doesn't have any much of the family history. And when I did the assessment on this patient, the exam finding was cough, wheezing, shortness of breath, fatigue, dizziness, and she was feeling a little bit drowsy. She was complaining of headache. Her voice was hoarse, but there was no drainage from no nasal congestion or no drainage from the ears. Her throat was okay, no redness or sore throat. She did have some chest pain, which was 7 out of 10. With coughing, it was more. No sinus pain, no epistaxis. She did report mild headache and dizziness, and some episode of syncope, which happened this morning. So, depending on the no fever, denies any fever or chills. Depending on the symptoms, the differential diagnosis that is most likely is asthma, because of the symptoms: shortness of breath, coughing, chest pain, and family history of asthma. And she also had a history of asthma during the high school. The next differential diagnosis can be COPD, and because of the symptoms, this is also the most likely diagnosis: shortness of breath, wheezing, chest pain. And then the third differential diagnosis can be viral pharyngitis. But the most common, or most the diagnosis that I came up to with this patient is the asthma. So according to the asthma diagnosis, the plan will be diagnostic plan will be to do the pulmonary function test, and that will help us, measure the breathing. Also, we can do FeNO test, which shows the highest level of nitric oxide, means there's more inflammation and irritation. The treatment we can do was will be a quick relief bronchodilators, or we can also give albuterol, which can be used 3 to 4 times a day for 7 days. And then we can educate the patient to avoid the triggers, avoid the allergen, avoid the dusty environment. She can even try and then or try to not drink when she is on medications, and also basically avoid the triggers like smoke, pollens, dusty areas. And the education wise, we can also provide the patient to control the asthma symptoms, avoid the triggers, avoid alcohol. She can do this like a natural remedy with lemon tea with the honey, and she can follow up in 1 week. And also, if her symptoms get worse with the even with the treatment, then she can call 911. And if she have very really difficult breathing that cannot be managed at home, she can call 911 and go to the nearest emergency. She does not need any follow-up at this time, and we will manage her symptoms, and we will schedule a follow-up in 1 week to see if there's any improvement in her symptoms. Thank you so much.